News about coronavirus infections occurring in the United States can make people feel uneasy. And while it is imperative to stay informed and be vigilant, it is also critical not to panic. On our website, www.hud.gov, on HUD at Work, and posted around our building, you will find information from the Centers for Disease Control and Prevention, or CDC, on how to stay healthy and stop the spread of germs. On our website, you will also find a link to the CDC website, which is updated daily with useful information, including a checklist to help individuals and families create a household plan to protect your health and those you care about in the event of an outbreak. Everyone should heed these warnings from medical professionals and practice common sense prevention measures you can use in your everyday lives to ensure you and your loved ones stay healthy. Here are some simple steps to practice every day that help stop the spread of germs. Cover your nose and mouth with a tissue when you cough or sneeze. Throw the tissue away immediately. Wash your hands often, especially after you sneeze or cough, with soap and water for at least 20 seconds. Avoid close contact with people who are sick. When you are sick, stay home until you are better and keep your distance from others. Avoid touching your eyes, nose, or mouth. Stay healthy. Now more than before, it is important to stay hydrated, exercise, eat healthily, and get enough sleep to ensure we can continue our mandate serving the American public and HUD-assisted families. At the end of each workday, take home your government-issued cell phone, laptop, PIV card, and other portable work devices that allow you to work remotely should you need to stay home. Make sure your supervisor has the most up-to-date contact information for you and that you have their contact information. If you experience symptoms, please do not come to the workplace. Contact your supervisor about workplace flexibilities such as telework and leave. If you have any unique concerns about coming into the workplace, please contact your supervisor to discuss workplace flexibilities such as telework, leave, adjusted work schedules, alternate work sites, and other options. Stay informed. The more you know, the better prepared you are to protect yourself, your loved ones, and your fellow HUD employees against the virus. Again, please visit HUD at Work to see fact sheets from the CDC on awareness, safety, and prevention. Please note that I am staying informed as well. At the request of the Vice President, I'm lending my expertise as a longtime medical professional alongside Secretary Azar to further support the President's already unprecedented response efforts for the safety, security, and health of the American people. We are a compassionate nation, exemplified most by the first responders and medical professionals dedicated to the well-being of their fellow citizens. Still, we are an innovative and resilient nation, and President Trump has some of the smartest people in the world working to eradicate this threat. Please rest assured that we will continue to relay all pertinent information when it becomes available in a timely fashion. It is important we do all our daily part in practicing common sense health precautions to keep our office, our fellow teammates, and our loved ones safe. Thank you, and be well.